of economic growth.
Yep.
So we're back to the levels of, I know 2016. That's why we can't have industries like Rogers and like the agriculture and horticultural sectors
Stephen,
that can't get workers.
We must squeeze in some good news now because we're almost out of time, but we want to turn to the empty roofs of Auckland high-rises into community gardens. That's the brainchild of one Becky Umbers, and she hopes to get the project off the ground. It's been dubbed Kai in the Sky, a non-profit initiative which will see staff from hospitality businesses tending to the gardens and use the produce grown there for free. To tell us more, Becky Umbers, welcome to the program.
Kia ora, how's it going?
I'm very well. So Kai and the Sky, what made you think of this idea, turning these empty rooftops into produce gardens?
Yeah, well, it's been an idea of mine for a while. I always saw all these roofs, especially when I was at uni, at UT, I could look out and see all these wasted roofs. And there's so much space and they get so much sun, so much rain, and it's just all grey concrete for miles. And I just thought, what a perfect place to grow vegetables. And it just seems so wasted at the moment. And Auckland is a bit of a green desert at the moment. And then, when COVID kind of happened, because I've always wondered how I would get it kind of off the ground, what would be the push that people need to kind of get involved. And I think COVID is that push. And I think people, with all the struggling hospitality businesses at the moment, it just seems like the perfect time.
Well, it's a great idea because people want local produce, don't they? That's the thing these days. And if it's just down the block, up 14 floors up, all the better. So how's it going? You've evolved the concept. What's the next stage?
So the next stage, so we're talking to engineers, we've been doing all that kind of stuff. The next stage, we need more buildings. So if anyone's listening and going, oh, I forgot about that building I own downtown, get in touch with me. We need more buildings at the moment. And then, we're aiming to have our first garden up and running by the end of September.
Wow.
So that's perfect for
all right,
spring.
Ben, if you are a building owner and you're listening to this, why don't you get in touch with the panel at rnz.co.nz? It's quite a good idea. It's a great idea, and we'll put you in touch with Becky Umbers. I have one question for you. How do you get all the soil up the top?
A series of trips in the elevator. But it'll be in planter boxes. So there'll be small-scale gardens to begin with. So
right.
The planter boxes are going to be made out of sort of recycled old furniture, that kind of thing, old barrels that you see, those blue barrels that are on every farm for some reason, those kinds of things. So they're all pretty lightweight and easy to get up there, and then we just take bags of soil up. It's
been done in America for years, Chicago, etc. It's not an original idea.
And Singapore.
And Singapore. Yeah, Lila, good idea.
It's a sizable industry there.
Yeah, Paris has just opened, a while ago, opened a huge farm on top of the building, and it's enormous. And it's just, we're a bit behind over here, really.
All right. Fantastic. Someone says, get into Auckland University, heaps of buildings. Many places have beehives on their roofs. Becky, thank you for that. And Lila Haro, Stephen Jacoby, you've been wonderful this afternoon. Thank you very much for joining me.
All right, thank you.
Checkpoint up next. Stay tuned for the latest developments across COVID-19 and everything else. I'm Wallace Chapman. See you for Friday, 3:45. Till then, bye.
Whakarongo mai koe ki te reo irirangi o Aotearoa. This is Checkpoint on RNZ National. I'm Lisa Owen. E haere nei, the number of community cases of COVID has ballooned to 17. As the Prime Minister warns, the cluster will grow before it slows. Health officials still have no idea what the source of this new outbreak is. Minister Chris Hipkins is live with the latest. How will Cabinet decide tomorrow whether to ramp up alert levels up and down the country? A school community is on high alert after a student returns a positive test. We're in Rotorua, where testing stations are swamped as it's revealed positive COVID cases also visited Taupo and Waikato. And Aucklanders, yep, you, I'm talking to you. Stop trying to sneak through roadblocks to get to your holiday homes.
RNZ News at 5. Kia ora ko Susana Leatawa tēnei. The country now has a cluster of COVID-19 cases in the community, with another 13 people testing positive. They are all close contacts of the 4 cases identified on Tuesday and bring the total to 17. The Director General of Health, Ashley Bloomfield, says all people who test positive will now automatically be moved to a quarantine facility. One of the new cases of COVID-19 in the community visited a rest home in Waikato a day before developing symptoms. Ashley Bloomfield says the person who has since tested positive wasn't symptomatic at the time of their visit. All aged care facilities are currently closed to visitors. Dr Bloomfield says the rest home won't be identified until all staff, residents and families have been contacted.
The visit was when the person was not displaying any symptoms, but they did develop symptoms the next day. The visit was to a family member resident, and the visitor saw their family member and had some contact with several staff. I know at least one person who has been tested already has returned a negative test there.
All staff and residents in the care home are being tested today. And 2 members of the COVID-positive Auckland family also visited Taupo on their Rotorua trip. On Monday, they visited Sail Barbary Eco Sailing at 10:30 and took a boat trip. Everyone on it has been identified and contacted and is being followed up as a close contact. Ashley Bloomfield says there is currently no need to extend the Alert Level 3 to Rotorua or Taupo.
Our experience earlier in the year was that the vast majority, over 95% of cases, occur in workplaces and in households, not through casual visits to places.
The Prime Minister is refusing to be drawn on whether or not Aucklanders will see harsher lockdown restrictions from tomorrow night. Cabinet is meeting tomorrow morning to discuss the next steps, and Ms Ardern will announce the decision in the afternoon. Jacinda Ardern says that she doesn't want to preempt that decision.
I don't want to speculate. I do want to use all the information we have. I do want the Director General to have the time to give us considered advice and information. And again, what we see within the cluster will be critical, as well as what we might see, if anything, outside of that.
Prime Minister Jacinda Ardern. Meanwhile, new economic research suggests lockdown measures have reduced growth by $21 billion. The research by the New Zealand Institute of Economic Research says GDP, which means the value of goods and services, has fallen to levels similar to 2016. Scientists mapping the genetic makeup of COVID-19 in New Zealand say the latest cases are similar to infections in the United Kingdom. ESR is working to identify the genomic sequence of the new cases in an attempt to find out when and where the virus was transmitted. No links have so far been found with sequences obtained from cases in managed isolation and quarantine facilities. However, not all the samples from these facilities have been analysed yet, and more results will be available tomorrow. A leaked report has revealed serious high-level failings in how the Transport Agency awarded major contracts. RNZ fought the agency unsuccessfully for over a year to release the report, which has now been leaked to the media organisation Newsroom. Phil Pennington reports.
The Transport Agency has not yet officially released the report, but has now confirmed it referred the matter to the Serious Fraud Office last year. The agency says the independent inquiry has found a senior manager had major conflicts of interest over developing safety apps that failed to work anyway. The manager, Martin McMullen, rose to head NZTA's high-tech unit where similar practices carried on. He quit last year, forming a transport app company with other former NZTA staff as shareholders. The agency says it has fixed the problems. This is Phil Pennington.
It's coming up to 4.5 minutes past 5. The Hurricanes are committed to playing their final round Super Rugby Aotearoa match against the Highlanders. Under COVID-19 Alert Level 2, Saturday's match in Dunedin can go ahead without spectators, but a move to Alert Level 3 would likely force it to be called off. Hurricanes co-captain Dane Coles says they'll play if they can.
We had a discussion this morning, about if people did feel comfortable or not, and like everyone's pretty much, jumped on board. And if someone didn't feel comfortable, 100% would give him that, respect, and he could stay home with his family and stuff like that.
Dane Coles' fellow Hurricanes co-captain TJ Perenara won't travel if the match is played, as his wife is due to give birth to their first child. A return to the ring is looming closer for the New Zealand boxer Joseph Parker. The former WBO heavyweight world champion hasn't fought since late February because of the COVID-19 pandemic. His British promoter Eddie Hearn says they're finalising details for a fight on Kiwi soil in October. Responding to Hearn's comments, Parker's manager David Higgins says that's probably too soon and the bout likely won't happen until November or December. The New Zealand driver Scott Dixon has posted the third fastest time on the first day of practice for next week's Indianapolis 500. Meanwhile, fellow New Zealander Mitch Evans still has slim hopes of finishing runner-up in the Formula E Championship. Evans finished 7th in the season's penultimate race in Berlin to reach 4th in the standings. That's the news.
Politics and the pandemic.
Grant Robertson could never have made such an outrageous statement.
Grant Robertson made an outrageous statement? I'm sorry, what was that?
Well, have you accused me of saying that? I mean, honestly.
No. We heard what Jerry Brownlee, your deputy, said the other day. What did he mean by that?
Well, you should have asked him. I'm very happy to
Well, we have asked him.
I'm very happy to say this, Tim, and please let me finish.
Pressing for answers and challenging newsmakers. Morning Report. Weekdays from 6 on air and online.
Now the short forecast from Met Service to midnight tomorrow. In the west from Northland to Kapiti, also central high country. Areas of cloud and isolated showers clearing from Auckland southwards tomorrow morning with fine spells increasing. Coromandel, Bay of Plenty, Gisborne and Hawke's Bay generally fine today. Cloudy periods and a few showers tomorrow. Wairarapa and Wellington, cloudy periods or cloudy spells and a few showers developing tonight and clearing tomorrow. Nelson, fine weather apart from brief showers early tomorrow. Bulla and Westland fine tonight, cloudy periods and a few showers tomorrow. Marlborough and Canterbury mostly cloudy, a few light showers. Showers retreating inland tomorrow morning, then clearing early afternoon and fine spells developing. Otago, Southland and Fiordland, cloudy areas tonight, a few coastal showers, fine spells tomorrow. And Chatham Islands, occasional showers. RNZ National. It's coming up to 7.5 minutes past 5.
Thanks, Susanna, and welcome to Checkpoint. I'm Lisa Owen. There is now officially a cluster of community transmission in New Zealand with 13 new COVID cases confirmed today. They are all close contacts of the 4 cases identified on Tuesday, and all are in Auckland. 1 is a student at Mount Albert Grammar. 3 are employees at Americold, the workplace of one of the original cases. Another 7 cases are family members of these employees. Another is an employee at Finance Now, the workplace of one of the original cases. This person was admitted to North Shore Hospital overnight but has since been discharged. And they have also infected a member of their family. There is also 1 probable case of COVID-19 in the community, also linked to the new outbreak. The Prime Minister Jacinda Ardern says the nature of clusters is they grow before they slow. And she's preparing people for case numbers to continue to rise. Here's political reporter Yvette McCullough with a wrap-up of today's updates.
Ms Ardern says the resurgence plan is being carried out in an urgent but calm and methodical way. Yesterday, more than 10,000 swabs were taken and 6,006 tests were processed.
At this stage, heartening to see them in one cluster. But once again, we are reminded of how tricky this virus is and how easily it can spread.
Director General of Health, Dr Ashley Bloomfield, outlined more details of the travel movements of 2 of the initial 4 cases today. As well as travelling to Rotorua, they went on a day trip to Taupo and went on a boat tour. Dr Bloomfield says one of the 13 new cases also recently travelled to Waikato to visit a relative in an aged care home. He says all staff and residents are now being tested and anyone who has recently visited the home will be notified.
I must say that the visit was when the person was not displaying any symptoms, but they did develop symptoms the next day. I know at least one person who has been tested already has returned a negative test there.
Dr Bloomfield has also made the call that community cases will have to see out their isolation in managed quarantine facilities.
These facilities are expressly set up to help minimise any risk of further infection in the community. Since we have them there, we felt it was best for not just those who test positive and their families, but for the community to actually really strengthen our response.
While there is more information on the cases and their contacts, it's still no clearer how the virus got back into the community. Sequencing of the genome has found no exact link to any recent cases in MIQ. However, not all of the swabs of recent cases were able to be sequenced.
But what we do know is that the genome sequence of the new cases broadly most closely resembles the pattern from the UK and Australia.
Despite known cases travelling outside of Auckland, Dr Bloomfield doesn't see the need to impose tougher restrictions across the country at this stage.
Over 95% of cases occur in workplaces and in households, not through casual visits. But at this point in time, it seems very clear the locus of the outbreak is in Auckland.
But Ms Ardern is refusing to speculate on what this could all mean for lockdown restrictions beyond Friday evening.
I do want the Director-General to have the time to give us considered advice and information. And again, what we see within the cluster will be critical, as well as what we might see, if anything, outside of that.
Cabinet will meet tomorrow to discuss the next steps. Dr Bloomfield will hold the usual 1 o'clock briefing on his own tomorrow, and it will be later in the afternoon that the Prime Minister fronts with a decision on whether or not Aucklanders face a lengthy lockdown. From Parliament for Checkpoint, Yvette McCullough.
And joining me now is the Health Minister, Chris Hipkins. Minister, can we start? 17 community cases. Are health officials convinced in terms of this cluster that the original family, that they are patients zero for this cluster, or do we think that there's potentially infected people before them?
Well, at this point, we don't know where patient zero actually is because we haven't been able to identify how the original family, the first family that alerted us to this cluster, how they contracted COVID-19 in the first place. That's one of the reasons that we've had to take the reasonably, strong measures that we've taken because until we can run that down, until we can figure out exactly what's happened here, we need to be extra cautious.
So that's called upstream tracing when you're looking at the origins of it. What are you doing in order to find that?
Oh, look, we are doing everything, and we're tackling this from both ends in terms of going back through all of the contacts that the original family have had and then continuing to test and contact trace and test and contact trace all the way through. But we're also approaching it from the other end. We're looking at areas where there may have been risk. So looking at the border, all of the border staff are being tested, and we're well through that cycle. We've set a target of 72 hours from yesterday to test all of the staff working at the border, all of the staff working in managed isolation and quarantine, so that we can just, discount that as a possibility. So we're really looking at trying to, gather as much information in as quick a period of time as we can so that we can piece this puzzle together.
So what's the working theory then now? What's the likelihood of where this came from?
Look, there isn't one working theory. Of course, there's, multiple different scenarios about how this may have occurred. And at the moment, I wouldn't rule any of them in or out. So at the moment, we're canvassing every possibility.
So the genome sequencing, as we heard today from the Director-General of Health, so far shows no obvious links to managed isolation and quarantine strains. So what are the implications of that then?
Well, look, we're a little bit cautious about that because, as the Director-General also said, the genome sequencing from the results that we've seen in managed isolation and quarantine aren't necessarily at the level that we could be certain about that. Obviously, it does tell us something, but it doesn't give us the complete picture. But it does suggest that, the virus or this particular strand has probably originated in the UK or Australia, but how it ended up in a family in Auckland is something that we're working our way through.
So infected people are moving to the Jetstar, isn't it? The Jetstar quarantine hotel, the community cases. How are you going for capacity there?
There is capacity at the Jet Park Hotel, and of course we've got the ability, if we really end up being stretched, to set up a second quarantine facility. Obviously we've got managed isolation.
Where would that be?
But it would most likely be in one of the managed isolation facilities we've got. But at the moment, we've still got plenty of capacity within the Jet Park to take these extra families.
So you wouldn't increase capacity overall, you would co-opt one of the isolation hotels and turn them into a quarantine facility. Is that what you're thinking?
Well, that would, we would cross that bridge if we came to it, but that's obviously a likely scenario.
So what does that mean for people who have booked places to come back from overseas? Are you asking Air New Zealand to put a hold on flights as a consequence of what's going on?
No, as I said, at the moment, we've got plenty of capacity at Jet Park, and we're well away from the need at this point to expand capacity, but what I'm indicating is if we have to, we can.
So can you give us an update on the situation with the rest home facility? That's in Matamata, isn't it?
That's correct, yes.
And so has anyone tested positive from that facility?
So I don't have any further results there to release, but I can confirm that everybody who needed to be tested has been tested, and of course we'll have the test results of that in tomorrow's update.
Because the Prime Minister was very clear today, wasn't she? She says this is going to grow before it slows. So what are health officials telling you to expect in terms of spread?
Look, at the moment, that's very difficult. Obviously, you can look at academic models, but actually, the reality is that this is a
Have they given you parameters, Minister? Can you just confirm whether they have given you a working model with some upper numbers in relation to this outbreak?
No, but we know that at the moment, all of these cases are within a cluster, so they're all interconnected, and that does, to some extent, draw a bit of a ring around it, which means that the faster we do the testing and the contact tracing of all of the contacts, then the faster we'll be able to really draw a ring around it. But of course we're continuing our widespread community testing as well, because if there's anything else out there, we want to pick that up too.
How many people are you up to in terms of contacts that you have to trace?
Several hundred contacts so far. I haven't got the most exact number, but it's around 400 was the last update that I saw a few hours ago of the number of close contacts that were being contacted, and they're well through that. We've got about 160 people working the phones at the moment to do that, so as the new contacts are added in, they're contacting them reasonably quickly where they can get hold of them. There's only one, I believe, where they've sort of set the finder service onto it. They can't get hold of them and they can't find them, so they've got one that they're that they've got someone out trying to find. Other than that, they are managing to get hold of people, and there's obviously a lot of testing going on.
So you were expecting, it was said, the surface swabs back from the Cool factory in Miracold this afternoon. Have you got them back, and what do they show? No, they haven't come back yet. When are you expecting those results?
We were told to expect them this afternoon. They'll take as long as they take, but we're certainly hoping to have them before the end of the day.
Okay, specifically, what factors are you going to consider? What's the list of things to consider when you decide whether to extend the alert levels either in Auckland or in any other parts of the country?
I think spread of the virus, the number of active cases, the number of new cases that we're seeing each day, the number of overall tests, both in Auckland and also around the rest of the country, and what those test results are showing us. All of those things will come into play.
Okay, is it conceivable that we could have one island in level 3 and another one in level 2?
Look, I don't want to speculate on that. We were clear though when we set out the resurgence plan, and we did that well over a month ago now, that we have allowed for regional variation.
So all the way through this, when we had restrictions and lockdowns, the Prime Minister often stated that she was following the infection cycle when Cabinet made these decisions, the 14-day incubation period. Can we expect the same principle to be applied when you're considering further restraints on movement?
Look, I think that's a decision for tomorrow, and we'll certainly have more to say about it.
Understand that you will make the decision tomorrow, but I'm just wanting to work out what the parameters are. So is it likely that if you want to extend the lockdown, you would need to do it in line with what incubation periods are for COVID?
Look, that's going to depend a lot on what information we have by tomorrow. We have done a lot of tests, both today and yesterday, and we expect those testing numbers are continuing to climb, which is a good sign. And of course, what they are showing us, we will know more about tomorrow morning.
The National Party's been bemoaning a lack of information from you and a briefing for Shane Reti. Have you met with their health spokesperson?
Yes, I met with Shane Reti this afternoon, I think at lunchtime. We had a very good discussion. I think the feedback that he gave me was he was very satisfied with both the work that we were doing and also the quality of the briefing. What
specifically did he want? What was the bit of information that they were missing, that they desperately wanted?
Look, I think they wanted to understand what we were doing. They wanted to understand the issues that we were addressing. Basically, I think they wanted a bit of an overview of how the contact tracing was going. I think we gave them some reassurance that we're doing everything that we need to be doing. They asked a few questions. It was a very useful discussion. I think they were happy when they left. And I've also indicated to them that they can contact me at any time, and we'll keep regularly in contact with them as we need to.
Did he make any suggestions that you'll be pursuing?
No, there weren't any particular suggestions that came out of that, but, it was a good constructive discussion.
Very quickly, because I know you've got to go. Schools, are you expecting them to stay closed next week? Because if you're letting them know late Friday, that doesn't give them much chance to turn things around, does it?
Look, we'll let schools know as soon as we can.
Appreciate your time this evening. That is our Health Minister, Chris Hipkins. National's health spokesperson, Dr Shane Reti, was invited on the program this evening, but he declined to join us. It is 21 minutes after 5 and you're with Checkpoint on RNZ National. We're keen for your feedback on that. You can text us on 2101, tweet us at Checkpoint RNZ, or email checkpoint@rnz.co.nz. Knowing what we do right now, what do you think is going to happen tomorrow in terms of the restrictions in Auckland and beyond? COVID testing stations in Rotorua were swamped today and a pop-up clinic was set up as hundreds raced to be tested. More details have been released about where some members of the South Auckland COVID family went on a 3-day trip to Rotorua and Taupo. As our video journalist Logan Church reports, while some locals are frustrated, everyone's taking precautions.
People started queuing for tests at this new pop-up COVID testing station at Rotorua's International Stadium this morning, well before its 9 a.m. opening. Hundreds of people in their cars, all wanting to make sure COVID-19 is not back in their community after members of an infected family from Auckland visited last weekend. About 100 cars up the line, Christina was waiting with her 3 kids.
We've all got little bits of coughs and runny noses, but we were actually connected to somebody else who was staying at the hotel that somebody tested positive. So they're in Dunedin, they've all been tested, and also family in Auckland, we're all connected, so they've been tested as well.
So everyone's being tested just as a precaution?
Yeah, and also family here, they've been tested yesterday.
They're playing I Spy to pass the time. They have another hour to wait.
We were actually here about 9:15, thinking that would be nice and early for the 9 o'clock start, but yeah, no.
Kim Wallace and her family are a few cars up the line.
Yeah, we were way back up the road, of course, and it hasn't moved a lot, but I think it's starting to move a wee bit, but I think we've got about a good 2-3 hour wait, so I hear.
The line continues up to the end of this road, round into the next, and then some. Several of the people waiting are staff from some of the businesses the Auckland family visited. Lawrence tells me his boss told him to come down and get tested.
So I'm down here today because I was up in Auckland on the weekend, and also I was up at the gondolas, so my boss sent me down to a precautionary check so I don't spread it at work, I suppose, if I have got it.
He says it's frustrating that his town is in this position, but says mass testing like this is the right thing to do and worth the wait.
I'm actually a little bit angry, 'cause we've done our homework, but well, it is what it is, and we just got to carry on and get it sorted, I suppose. We've got to get tested so we see if it's in the community and keep everyone safe, I suppose.
The Director General of Health, Ashley Bloomfield, released more details today about where members of the Index family visited on their 3-day trip to the region. That included Wairoa Lakeside Hotel and Herb & Spice's Thai restaurant on Saturday the 8th of August, the Fat Dog Cafe, Pack and Save and Skyline Rotorua on Sunday the 9th, and Rotorua Heritage Farm 3D Arts Gallery, Burger Fuel Redwood Centre and Don Kebab on Monday the 10th. A boat cruise in Taupo is also being followed up by the Ministry of Health.
We have issued an exposure alert covering the 2 separate visits of the family in Rotorua to the Heritage Farm and also the 1 visit to the Skyline Gondola. So that alert has gone out to anybody who has the app and had used it to scan in at the times that family was at those facilities.
At lunchtime, the queues are still long at swabbing centres. Cars are still flooding into another testing station on the other side of town on Vaughan Road. People who've walked in wait in a socially distanced line that snakes through the centre. Dr Bloomfield also confirms that none of the new 13 COVID cases revealed today were outside Auckland, something Rotorua's Mayor Steve Chadwick welcomes. She says the town is prepared if case numbers increase.
Well, we've been forewarned that there would be a resurgence at some stage, and we've always had that preparedness here in Rotorua, and we haven't taken it for granted, but now the possibility is there. So it's for our community to step up, wait for the experts to tell us what to do and be ready to respond. And we are, and I hear things are quite calm out there.
Ms Chadwick says it's right for Rotorua to stay at alert level 2 despite the risk, as businesses and residents have been proactively keeping themselves safe.
I was really pleased to hear last night that some of the eateries, they didn't know if they'd been there, but they decided they'd do a deep clean and they'd social distance and wait. Now that's the right advice. So it's not for us to say escalate it up. We don't want panic. We want people to be prepared and then do the right thing when we're told.
The testing stations here and in Taupo have extended their hours for the time being and expect to be busy, all in the hope that this new outbreak will be quashed as quickly as possible. In Rotorua for Checkpoint, Logan Church.
If you were listening a short time ago, we were talking to the Health Minister, Chris Hipkins, who says that the COVID-positive community cases are being moved into quarantine at the Jet Park Hotel. Well, the Minister who manages quarantine, Megan Woods, we did invite her onto the program this evening, but she declined that invitation. She did provide this statement. She says, we're working with the Ministry of Health to ensure there is capacity within our Auckland quarantine facility to accommodate positive COVID-19 cases. Since Tuesday night, Air Commodore Webb and his team have been carefully managing capacity to ensure we were ready to rapidly respond should quarantine facilities be required. Moving people with COVID-19 into quarantine as we all work together to urgently contain the current outbreak is an important part of our health response to help prevent the risk of virus spreading between family members and to other people in the community. Spare capacity at the Auckland quarantine facility is currently 61 rooms after the arrival of today's community cases. Despite a surge in COVID-19 cases in the Auckland community, it appears not everyone is on board with the latest lockdown measures, which came into force at lunchtime yesterday. Residents could also be seen taking to public places, some of which carried no obvious signs of being closed down or cordoned off. Our cameraman Nick Munro and Nick Trubridge hit the super streets today and discovered a chorus of scepticism as to whether residents are sticking to the rules.
The rest of New Zealand probably thinks Aucklanders are pulling out all the stops to avoid returning to another long-term COVID-19 lockdown. But residents spoken to by Checkpoint are not convinced level 3 restrictions are being taken seriously in the super city.
I would say from what I've seen, not really. There's a small sliver that are wearing masks, but not as many as I'd expected. Beyond what I've seen, I know a lot of people that have tried to escape the city, and I think that's pretty unimpressive given we're trying to keep it in the city.
It's just after midday on Ponsonby Road. The roads are noticeably quieter than they were during yesterday's lunchtime rush. There's a smattering of people out and about getting fresh air as they take a break from their home offices. All surefire signs that Aucklanders are sticking to level 3 restrictions. Though looks can be deceiving.
I think they're probably a bit more relaxed this time around, maybe not taking it quite so seriously by the looks of things.
It's 3 months to the day, May 13, since we were last in level 3. This woman, who's taking her dog out for a walk and is waiting for a much-needed flat white, is sceptical as to whether her fellow Aucklanders are taking level 3 restrictions seriously.
Probably 50-50. There's a couple businesses that kind of look like their doors are open and you can just walk in, which I didn't think you could do. And there's some people that don't seem to want to go to the other side of the footpath, and that's something we saw the last time as well. Some people, give you a nice wide berth and some people don't, and the dog kind of pulls me whichever way. So, yeah, I think the government could have been a bit clearer about what they were trying to accomplish, because I think that helps people make better choices.
She's not convinced people even remember what level 3 means.
Level 4 was so easy because the rules were very strict. And then when we came out of level 4, I think a lot of people didn't really change their life very much at that point into level 3. Kind of jumping right into level 3 was a bit tricky, I think, for a lot of people. There were tons of cars on the road yesterday. I don't know where everyone was going.
As for the prospect of an extended super city lockdown,
I think they need to relook at whether a lockdown is actually required, whether maybe reassess some of the rules around it. For example, open up more stores. Like Bunnings is a good example for something like that.
Do as we're told. Listen to the people who are telling us what to do that, and the sooner we do that and get it done, it's over.
Meanwhile, despite Auckland Council supposedly closing public facilities during Level 3 restrictions, Checkpoint witnessed dozens of families taking to public playgrounds. Unlike Levels 3 and 4 last time around, there did not appear to be much in the form of tape and signage signalling closures. There were no obvious signs of barriers as locals took to the Flying Fox and playground at Sandringham's Gribblehurst Park. The only sign of closure at Mount Eden's Potters Park was smaller than an A4 piece of paper, which was ignored as excited kids took to swings and slides. An Auckland Council spokeswoman says playgrounds are closed and simply that they hope Aucklanders are respecting that. Back on Ponsonby Road, lax attitudes aren't the only issues reported by Aucklanders spoken to by Checkpoint.
And in terms of face masks, I'd be wearing one if I had access to one, but I cannot find one at the moment.
Really? So for the life of you?
Well, I've ordered them online, but they haven't come, and I've gone to the supermarket and pharmacy and there haven't been any available, so I've just got to wait. But all the online stores said they'd take like at least a week. So, yeah.
Earlier today, Prime Minister Jacinda Ardern also addressed price gouging concerns in relation to New Zealand's face mask supplies.
My message is exactly the same as it was the first time New Zealand experienced restrictions on movements and the need for really critical items. Fairness. We're asking people not to try and capitalise on the situation New Zealand is in. My message also to consumers is that you don't have to have a surgical face mask. A face covering that you perhaps fashion yourself is adequate. We are actually looking through the advice of health to distribute some information of the kind of face coverings, if you're using your own, are going to do the job, just so that people don't have to rely on purchasing something that might be financially out of their reach.
So an unsettled start to day one of Auckland's return to lockdown, which, if today surged to 17 community cases is a sign of things to come, could well last for some time yet. For Checkpoint, Nick Trubridge.
And if you were listening to that piece from the two Nicks from Checkpoint, we'll put it up online. It'll be on our Facebook page so that you can check out the video. Now, Auckland Council has confirmed at Alert Level 3, all playgrounds, basketball courts and skate parks are closed, meaning they must not be used. But in a statement, it says there are no plans to remove play or sports equipment from our parks as we are limited to essential work only. Given the current 72-hour period for Level 3, this is also why there is no signage at Council's 940 playgrounds, they say. But the Council does go on to say if alert level restrictions are extended beyond Friday, it will look at reinstalling these. And coming up on Checkpoint on RNZ National, Auckland's COVID-19 cluster grows to 17. That already makes it our 11th biggest cluster. But how many more could there be? Physics professor and disease modeller Sean Hendy joins us live. Aucklanders continue to mob testing stations across the city today. And while our numbers rise, Victoria's start to flatten. 278 infections were reported overnight, the lowest number in 3 weeks. We would love to hear from you about anything that's been on the program so far this evening. Are you wearing a face mask? Have you had any problems finding one, or have you made your own? Text us on 2101. You can tweet us at Checkpoint RNZ, Facebook us, Checkpoint, or flick us an email, checkpoint@rnz.co.nz. We'd love a picture of you in your mask as well. Time for the headlines now with Susanna.
All people who test positive for COVID-19 will now automatically be moved to a quarantine facility. There are now 17 positive COVID-19 cases in the cluster, stemming from the 4 cases identified in Auckland on Tuesday. 13 new cases were confirmed in the community today, along with another positive case in managed isolation. Meanwhile, Health Minister Chris Hipkins has confirmed the rest home visited by a positive case is in Matamata. He says everyone who needs to have been tested has been. And 2 members of the COVID-positive Auckland family also visited Taupo on their Rotorua trip. On Monday, they visited Sail Barbary Eco Sailing at 10:30 and took a boat trip. The Director-General of Health says there is currently no need to extend the Alert Level 3 to Rotorua or Taupo. 8 volunteers from Ngāti Whātua will help police at the 5 checkpoints north of Auckland from tomorrow, and numbers will double if lockdown is extended. Their job will include helping to question drivers and handing out pamphlets with health and safety information. Masks and hand sanitiser have been added to Price Watch to prevent retailers from price gouging as demand increases. The Prime Minister Jacinda Ardern says she would be surprised if that's happening in supermarkets, as some of them are getting their supply from government. 2 million masks were supplied to Countdown. Hotels across the country are being inundated with mass booking cancellations following the return to higher COVID-19 alert levels. The Hotel Owners Association Executive Director Amy Robbins says hoteliers are fielding thousands of cancellation calls. She says it's beyond grim for an already struggling sector. New economic research suggests lockdown measures have reduced growth by $21 billion. The research by the New Zealand Institute of Economic Research says GDP, which means the value of goods and services, has fallen to levels similar to 2016. Researchers suggest border restrictions could last until 2022. Those are the latest news headlines from RNZ National. Our next news and weather update is at 6.
Thanks, Susanna. If you're just tuning in, this is Checkpoint and I'm Lisa Owen. And it's time now for the business news with Giles Beckford, who is in our Wellington studio. Giles, NZIER has put some numbers out on the impact of lockdown. What can you tell us about that?
Well, as we were just hearing in that final item of the headlines there, $21 billion is the cost that the NZIER puts on the close down related to the pandemic, and that's what it's cost the economy. Now, I just want to put some perspective around this because $21 billion is bound to excite a lot of headlines. First of all, this study by NZIER, it was actually presented to a conference nearly 2 months ago, so it's the middle of June, and we should see it also in the context that $21 billion wiped off the economy is about 7% of the economy, the value of the economy. Now, that's actually within the broad range of estimates that most economic forecasters have been putting out in the past 3 to 4 months. So from that point of view, it's not a brand spanking number, although the actual 21 billion may sound like a bit of a shock. In fact, just yesterday, the Reserve Bank, in its latest monetary policy statement, the forecasts it put out suggested that the economy will shrink by about 6% in best circumstances, good even circumstances, through to the end of the year, to be followed by a rebound growth, economic growth, of closer to 7% in 2022. So from that point of view, you see there's a down and there's the up, there's the rebound. So I think a little bit of perspective is needed. That's not to undermine the value of the work done in the NZIER report. It's another piece of important information. It just brings home to us the fact that COVID has a real strong economic cost. As the Reserve Bank was putting it yesterday, it will be a long and slow and bumpy road to recovery, and there will be dips and dives and potholes on the way. So, once again, we don't know really what the impact of further lockdown will be. If the whole country is to go to 3 or possibly Auckland being put up to a level 4 lockdown, then that will impose further economic costs, and we have to expect that our recovery will be that little bit more delayed.
OK, so a potentially positive economic story then is this big Swedish trucking company. It's investing big time in New Zealand. What's it up to?
Well, at times like this, you would wonder why would one of the world's biggest truck makers, this is Sweden's Scania, why would they fork out millions of dollars to buy a series of truck maintenance, repair, servicing outlets around the country? Well, they're buying a firm called Trucks and Trailers. They're buying 7 branches of that firm. We don't know the price, but it does go into the millions, and it will see a tripling of their workforce in this country. They're already pretty well established. Scania says quite simply, look, New Zealand is a country that depends on really big trucks, big rigs, driving big distances, especially in the provinces. Interestingly, the businesses that they're buying are largely in regions, West Coast, Canterbury, South Canterbury, middle of the North Island. They're going to set up a new facility in Rotorua as well. So should we just say a sign of confidence, a sign of a company that knows transport is vital to this economy, and in particular, it's one that will survive the pandemic. In some cases, it may even profit from the pandemic. And this is Scania's vote of confidence in New Zealand, because it's one of their bigger investments in the world this year.
Giles, what news do you bring of market numbers?
I bring news of a share market that was positive but just ran out of puff towards the end of the day. It started with, I won't say a hiss and a roar, but it was up a reasonable amount. It closed just 8 points higher, 9 points higher, 11,500. We won't worry about the minor details there of percentages. The New Zealand dollar sitting around 65.6 US cents, just touching 91.6 Australian, and a smidgen over 50.2 British pence.
And I have to wait for the gold and silver report until tomorrow, do I, Giles?
Well, I can give you gold. It was up $13 to somewhere around $1,900, but it's still outside of your pocket money.
Exactly. Thank you, Giles. That's our business editor, Giles Beckford, joining us from our Wellington studio. A school community is on high alert after one of its students tested positive for COVID-19. The Mount Albert Grammar pupil is a close contact of the family who had 4 members test positive this week. The student and family make up 5 of the now 17 people in the community confirmed to have the virus. Eva Corlett reports.
The student went to school on Monday but wasn't showing any symptoms. In the 2 days following, they became sick. Mount Albert Grammar is the second biggest school in the country, with roughly 3,000 students. Auckland Regional Public Health Service is working with the school and has identified 100 people considered close contacts. Those staff and students who were spread across 5 of the pupils' Monday classes are being asked to self-isolate. The headmaster, Patrick Drum, has declined interview requests. But in a written statement, the chair of the board, Greg Moyle, says
the school promptly advised the school community when we received the notification from the Ministry of Health yesterday evening. Naturally, our thoughts are with the student and their family, as well as the students and staff members in the contact group.
The Director General of Health, Ashley Bloomfield, says health officials have spoken with all of those close contacts.
The chance of exposure of anyone in the school community to the infection is considered low at this point, but of course we are taking all precautions, and everyone in the whole school community has been asked to monitor their health closely, seek advice from their GP or health line if they have symptoms of COVID-19, which could include a new or worsening cough, a sore throat, runny nose, fever, temporary loss of smell, and difficulty breathing.
RNZ understands teachers have been told not to speak to media. However, we understand teachers are worried about the positive test, but are happy with how the school is managing the situation. The Vice President of the PPTA, Melanie Webber, says teachers in schools across the country feel nervous.
There's absolutely a sense of here we go again, and it is concerning because in terms of students, particularly those senior students with NCEA, there are a lot of assessments coming through. Students are just getting caught up, and being locked down again now is going to make it really tough to make sure that we keep them on track in terms of achievement.
But she says this time around they're more prepared.
I think we're all better equipped in that we've done it before. We've got some ideas about what will work and what won't work. We did speaking for my school, I know we consulted with kids to find out what worked best for them in lockdown. So we've got some ideas.
Melanie Webber says the best thing students and teachers can do is stay safe and follow advice. The students' close contacts at Mount Albert Grammar will self-isolate for 14 days and other students are required to stay home. The school will remain open to children of essential workers. Mō te hōtaka o te ahiahi nei, ko iwa ko le tēnei.
Let's get to some of your feedback about the restrictions in Auckland. A listener from Orewa says, I was surprised to see how much north to south traffic there was on my walk today. At Hadfields Beach, I spoke to a tourist stuck here who is clearly travelling around. The streets were way busier than level 3 before. I think we need reminding of the level 3 rules, this person says. Someone else is querying the number of flights out of Auckland. 10 or 11 flights of Aucklanders that flew into Queenstown, they say, just before lockdown to avoid it. Definite potential that Aucklanders leaving to avoid lockdown will spread it outside the originally affected areas. And we do know that I think it was just over 300 cars were turned away before 7 o'clock this morning at those checkpoints that have been set up around Auckland for various reasons. They were going places where they shouldn't have been. And this person says, why, after closing the roads around Auckland, were people allowed to leave Auckland via flying elsewhere? Yep, good question. Another one says, why should the council have to spend money for a 3-day level 3 closure? This is about signs on the playgrounds or really putting a barrier up to stop people using them. Everyone knows you're not supposed to use public parks. The council had to cut its budget and needs to be careful with how it allocates funds. Yeah, you might think everyone knows, but check out that video from our reporter Nick Trubridge. It'll be up on our Facebook page. They might know, but they're still using it. The political clash surrounding the COVID-19 cluster has escalated, with the opposition accused of peddling conspiracy theories. Labour, New Zealand First and the Greens say National is being irresponsible and dangerous. But National says it just wants answers. Here's our Deputy Political Editor, Craig McCulloch.
The return of COVID-19 may have put an end to campaigning, but the politics is only ramping up. Today, a wave of fury from all three government parties in response to the stance adopted by the opposition.
Haphazard and careless, and it's irresponsible.
I think incredibly dangerous.
Ridiculous nonsense.
The strength of feeling sparked by this, an extraordinary news conference fronted by Judith Collins yesterday, in which she raised questions about the official timeline.
We're hearing a lot of rumours. I'm sure you've heard rumours too.
Her deputy, Jerry Brownlee, then stepping up to the mic to list a series of what he deems interesting events, as if to suggest the government knows more than it's letting on.
All very interesting things to have happened.
The oblique suggestions have left Labour fuming. Grant Robertson not holding back this morning. He says there's absolutely no reason the government would put people's lives at risk by holding back information.
Mr Brownlee and Judith Collins are effectively accusing Ashley Bloomfield of being involved in some kind of collusion or cover-up with the government. He's an independent public servant who actually can't fight back. So, no, it's complete nonsense and it's also incredibly irresponsible.
Grant Robertson should never have made such an outrageous statement.
Ms Collins beginning the day in the defensive, telling Morning Report she's simply calling for transparency.
What does transparency mean? When you call for more transparency, Ms Collins, what does that mean?
I think we need to have information as soon as it's possible to have it.
Do you think that is not happening? Are you saying that information is being withheld from the public?
I think people need to know how this COVID-19, Kim, got into the community.
Yes, we all think that, Ms Collins, but you seem to be suggesting that they know something we don't. Are you suggesting that?
I have not said that.
But then what did Mr Brownlee mean in his comments yesterday?
Well, you should ask him.
New Zealand First says the National Party is spreading misinformation. Winston Peters says the once honourable party is collapsing.
I wish they would actually understand that it's not about politics right now, it's about the health and safety of New Zealanders.
And an exasperated James Shaw, co-leader of the Greens, says the conspiratorial musings undermine democracy.
Frankly, it's so absurd. I'm clearly struggling to respond.
Mr Shaw is himself waiting on a test result back after developing a sniffle following a trip to South Auckland over the weekend. The opposition will get at least some more answers tomorrow, along with the country, the Prime Minister to announce what next for the latest lockdown. Atu i te whare palemata mō te hōtaka o te ahiahi, ko Craig McCulloch.
It is about 9 minutes to 6. I'm Lisa Owen and you're with Checkpoint on RNZ National. Just been looking at some of you sending in your pictures of masks. Keep them coming. There's some absolute doozies. From the Max, loving the gingham and the fact that we're on in the background on your TV. So you can text us on 2101, tweet us at Checkpoint RNZ, or send us a picture via email, checkpoint@rnz.co.nz. We hope to show you some of them before the show is out. A lot of hope is being pinned on the development of a vaccine for COVID-19, with the hope it will allow life to return to normal. However, experts say the public would need to have high confidence in it because 80% of people would need to be immunised to protect the rest of the population. Conan Young explains.
While a lot of faith has been put in a vaccine to rescue the world from the clutches of COVID-19, the speed at which some countries are developing them is leaving some nervous about how safe they might be.
Russia is claiming its government has just approved the world's first coronavirus vaccine.
The registering of a vaccine in Russia without it being put through crucial stage 3 trials is just the sort of thing that could erode trust in a vaccine, according to Dr. Nikki Turner from Auckland University's Immunisation Advisory Centre.
There's a huge risk. There are vaccines out there in the international market that I wouldn't touch with a barge pole, and it's really important that the scientists publish their data, that the data is transparent, fully transparent, and people can come in from the outside and critique the data.
In Samoa, large swathes of the population shunned the measles vaccine after the death of 2 babies from an incorrectly administered jab. Dr. Turner says health authorities here could avoid a similar reaction to the rollout of a COVID vaccine by ensuring people maintained high levels of trust in them, especially amongst marginalised groups who may have had negative interactions with the state.
So if you're already suspicious about your government or your health authorities, and then there's some significant human error, then that'll have more impact on people's confidence. Whereas if you have a community that has walked together, understands that science is really good but not perfect, and human error happens, then the community can rise above errors better.
University of Otago infectious diseases expert Professor David Murdoch is advising on the development of the Oxford vaccine, one of those showing the most promise at the moment. He says while Phase 3 trials could be finished as early as next year, corners are not being cut and safety isn't being compromised.
Actually, in preparation for that, gearing up factories, gearing up the facilities and the technology so that if it is going to be licensed, that they're ready to go, rather than waiting until it is licensed and starting to do that. Getting some of the accreditation paperwork underway early so that when all the appropriate studies are done, that we're already partway along that journey.
Professor Murdoch says before any vaccine was rolled out here, it would need to go through the same safety checks as any other vaccine.
Even though, there's obviously unprecedented interest in this vaccine and it's been produced faster than probably we've ever had vaccines before, we'll still require that same level of information to be provided, and that will be presented to governments, it will be presented to ministries.
Public health expert Professor Michael Baker says while 60% uptake could work, 80% would provide the best chance of this country achieving herd immunity. He says while achieving such high numbers will be a challenge, public confidence in such a vaccine should not be difficult to achieve.
Given that the vaccine is going to be used and probably being given to hundreds of millions of people, perhaps billions of people around the planet, there'll be a huge amount of data on how effective it is and if there are any safety concerns.
Michael Baker says an essential part of any rollout will be proper training for those administering the vaccine to ensure the mistakes such as the one that happened in Samoa are not repeated here. Mō te hōtaka o te ahiahi, ko Conan Young tēnei.
Across the Tasman, where Victoria has reported its lowest number of new coronavirus cases in 3 weeks. Another 278 infections were recorded today, along with 8 further deaths. Bridget Burke has the details.
It's the first sign that stage 4 restrictions introduced a week ago are starting to work. Despite that, Victoria Premier Daniel Andrews says there's still an upward trend in some regional parts of the state.
We have seen some growth in cases. They remain low in total terms, but we have seen some significant growth of cases in Geelong, Ballarat and Bendigo, and that is of obvious concern to us, so we're monitoring that very closely. There are regional public health teams that have been stood up in each of those different regional cities to try and have the most localised response, not just the quickest response, but one that's, I think, that benefits from having that local knowledge.
The Premier has announced further steps to make more testing available across the state. 3 additional testing sites will open in the cities of concern, along with more staff and longer operating hours at existing stations.
This is all about encouraging anybody with any symptoms in Bendigo, in Ballarat or in the Geelong region to come forward and get tested. Of course, the same message applies to every single person in regional Victoria. If you have symptoms, even very mild symptoms, then we would ask you to come forward and get tested. We will process that test as quick as we possibly can, and then you will have made a really powerful contribution to our collective fight against this enemy.
Victoria's government has taken over the operations at 3 more aged care facilities west of Melbourne. The sector has been struggling with staff since the outbreak. Daniel Andrews says state intervention is needed to ensure care for the most vulnerable and to avoid hospital when possible.
It is very challenging and often quite traumatic and can in fact be tragic if people are, without due consideration to their individual circumstances and their clinical need, simply moved from one setting, which is their home, to a completely unfamiliar setting, which is a clinical environment, a hospital environment. These decisions are made based on clinical need and no other factors come into it. We have created capacity, we have additional capacity. Anybody who needs, in the view of their treating doctor, to go to hospital will go to hospital.
Elsewhere, New South Wales recorded another 12 cases today, while Queensland reported 0. For Checkpoint, Bridget Burke.
To the US now, where presidential hopeful Joe Biden has stepped out with his running mate Kamala Harris for the first time since she was put on his ticket. The pair spoke at a campaign event in the state of Delaware where they wasted no time criticising Donald Trump's performance in office. It was a launch unlike any other previous campaign, with strict social distancing guidelines, ruling out the enthusiastic crowds of supporters who have been a hallmark of elections past. The BBC's David Willis reports.
Events of this kind normally take place before large and adoring crowds, but normal times these are not, and the first black woman ever to appear on a US presidential ticket was forced to make her campaign trail debut in a largely empty high school gymnasium. Nonetheless, the man who appointed her said Kamala Harris should serve as an inspiration to others.
This morning, all across the nation, little girls woke up, especially little black and brown girls, who so often feel overlooked and undervalued in their communities. But today, just maybe, they're seeing themselves for the first time in a new way as the stuff of president and vice presidents.
The daughter of an Indian mother and a Jamaican father, Kamala Harris is being looked upon as someone who can energize the Biden campaign and extend the Democrats' appeal to independent voters and even moderate Republicans.
This is a moment of real consequence for America. Everything we care about, our economy, our health, our children, the kind of country we live in, it's all on the line.
A former public prosecutor, she went on to challenge what she called Donald Trump's racist rhetoric and his handling of the coronavirus pandemic.
America is crying out for leadership. Yet we have a president who cares more about himself than the people who elected him. A president who is making every challenge we face even more difficult to solve.
You ready to go to work?
This is the moment Joe Biden offered his one-time rival for the Democratic presidential nomination the job as his running mate.
The answer is absolutely yes, Joe.
And the early signs are the choice is proving popular. In the 24 hours since then, his campaign has raked in $26 million in contributions. Meanwhile, President Trump has maintained his attacks, drawing on Kamala Harris's criticism of Joe Biden during the Democratic primaries.
She said horrible things about Biden. She said far worse about Biden than I ever did. And now she's running as vice president.
Joe Biden called this election a battle for the soul of America. Depending on the spread of the coronavirus, his new running mate is soon hoping to head out into the swing states with just over 80 days to go before the election.
And that was David Willis reporting. And just a point of clarification, the Health Minister's office has been in touch. He released information saying that the rest home where they are doing testing around COVID was in Matamata. He meant to say Morrinsville. It's in Morrinsville. So just to clarify that. A lot of you getting in touch about masks. This person says, I'm making my own cotton fabric, 3 layers, using hair ties. Someone else says, we've got a box of disposable masks, but we love the mask shown on TV by Nano Girl, large hanky with rubber bands. Do people still use hankies? Because I sort of think they're a bit gooby, you know. You do your business in them and then you stick them in your pocket and carry them around with you. Is that healthy? I don't know. Let me know what you reckon. Someone else says we should use common sense to say that when walking along a beach at a distance from others, there is no need for a mask, but that it is crucial when you are amongst people. Sarah has sent us a picture of her mask. Love this one the best so far, Sarah. It's got Frida Kahlo on it, and you get points for background too. Hopefully we'll show you some of those pictures a little later.
RNZ News at 6. Ngā mihi nui ko Susana Lei a taua tēnei. The Minister of Health has set out what Cabinet will consider when deciding if Auckland should move out of Level 3 lockdown tomorrow. There are now 17 cases of COVID-19 linked to a family in South Auckland, but the source of the cluster's original infection is still unknown. Chris Hipkins told Checkpoint ministers will consider the 14-day incubation cycle and the latest case information when deciding if the Level 3 lockdown should be extended.
Spread of the virus, the number of active cases, the number of new cases that we're seeing each day, the number of overall tests, both in Auckland and also around the rest of the country, and what those test results are showing us. All of those things will come into play.
The Prime Minister will announce Cabinet's decision tomorrow afternoon. Nearly 8,000 people were tested for the coronavirus in Auckland yesterday, smashing the previous record. And the city's DHBs say demand is still high today. They say 7,800 people were tested yesterday. The previous record was 6,400 on June the 24th. 9 pop-up testing clinics have opened in the past 24 hours, bringing the total to 15, as well as many GP clinics. The Central City Eden Terrace Clinic is being moved to Eden Park to avoid the traffic hold-ups it's caused. People turned away from overrun testing centres in Auckland have been returning for swabs today. Francis Collier was back at a community testing centre in Eden Terrace after he spent hours waiting there yesterday afternoon but didn't get tested. He has flu-like symptoms but says he's not so worried about himself.
Not my own health, but yeah, just concerned for it spreading. So this is the best way to get on top of it, is everyone tested and find out where it is.
Francis Collier. All 3 government parties have labelled the opposition dangerous and irresponsible, accusing it of spreading misinformation about the latest COVID-19 outbreak. The National Party says that's outrageous and it's simply looking for answers. Here's our Deputy Political Editor, Craig McCulloch.
The fury on the government side was prompted by National's news conference yesterday, in which Judith Collins and Jerry Brownlee cast doubt on the official timeline. Labour's Grant Robertson says there is no reason ministers or the Director-General of Health, Ashley Bloomfield, would put lives at risk by holding back information. New Zealand First issued a statement accusing National of undermining democracy, and the Greens called it conspiratorial and dangerous nonsense. Ms Collins says she simply wants transparency. From Parliament, Craig McCulloch.
Some people have tried to talk their way through roadblocks to get to their holiday homes outside Auckland. Hundreds of people have been turned around by police at 9 checkpoints since lockdown restrictions were imposed yesterday. The Prime Minister, Jacinda Ardern, says 17,000 vehicles were checked by 7 a.m. this morning and more than 300 turned around.
Police are reporting that there have been attempts made by people to travel to their holiday homes. Again, I just reinforce, if your residence is in Auckland, we are asking you to stay put.
Jacinda Ardern. New economic research suggests lockdown measures have reduced growth by $21 billion. The research by the New Zealand Institute of Economic Research says GDP, which measures the value of goods and services, has fallen to levels similar to 2016. It says the tourism sector is the hardest hit, and other sectors badly affected include accommodation, transport and hospitality. Researchers suggest border restrictions could last until 2022. Hotels across the country are being inundated with mass booking cancellations following the return to higher COVID-19 alert levels. The Hotel Owners Association Executive Director Amy Robbins says hoteliers are fielding thousands of cancellation calls. She says it's beyond grim for an already struggling sector. Ms Robbins says urgent financial relief is needed to support an industry that feels sidestepped by the government's recent tourism recovery package. It's coming up to 4.5 minutes past 6. The Wellington Phoenix desperately need striker David Ball in goal-scoring form if they're to make an impression in the A-League football playoffs. The Phoenix are an outside chance of still finishing in the top 2 and gaining direct entry into the semi-finals going into tonight's match against Newcastle. Ball has failed to score and made no goal assists in Wellington's last 5 games.
I was in a similar position at the start of the season, and the more and more it comes down to it, the more and more I might need that little bit of luck to just go in. That one against Western goes in, then you're firing and you're ready to go. It's just a case of getting that one over the line.
David Ball. Tonight's Phoenix match kicks off at 9:30. The former England international Lawrence D'Alio has taken a swipe at the All Blacks for their unwillingness to travel to the Northern Hemisphere to play tests this year. He used the Pakistan and West Indies cricket sides as examples when explaining to the Times Ruck podcast why it was possible to play matches, given they've travelled to England to play in recent weeks.
Clearly, New Zealand, South Africa and Australia don't want to come here, but there's no reason why the All Blacks couldn't come here, stay in the Lensbury Hotel, self-isolate, play 5-6 test matches across the autumn.
Lawrence D'Alio. A fight between the New Zealand heavyweight boxers Joseph Parker and Junior Fa is back on the table. Negotiations for the bout have stalled, or had stalled earlier last month. Parker's manager David Higgins says discussions are advancing again for a pre-Christmas fight, and Fa is still their preferred opponent. That's the news.
This is an official government COVID-19 announcement. The Auckland region is now under COVID-19 Alert Level 3. The rest of New Zealand is under Alert Level 2. If you're in Auckland, stay home if you can and follow Alert Level 3 guidelines. This will stop the transmission of COVID-19. If you must leave home, keep a 2-metre distance from others and wear a face covering if possible. For those who live outside Auckland, you must follow Alert Level 2 guidelines. All New Zealanders are asked to download the New Zealand COVID Tracer app to record all of your movements. If you have symptoms, get tested. It's free. Call your doctor or healthline for advice. For more information on the alert levels, go to covid19.govt.nz.
From Met Service to midnight tomorrow. In the west, from Northland to Kapiti, also central high country, areas of cloud and isolated showers clearing from Auckland southwards tomorrow morning with fine spells increasing. Coromandel, Bay of Plenty, Gisborne and Hawke's Bay, generally fine tonight, cloudy periods and a few showers tomorrow. For Waitarapa and Wellington, cloudy spells, a few showers developing tonight and clearing tomorrow. Nelson, fine apart from brief showers early tomorrow. Bulla and Westland, fine tonight, cloudy periods and a few showers tomorrow. Marlborough and Canterbury, mostly cloudy, a few light showers. Showers retreating inland tomorrow morning, then clearing early afternoon and fine spells developing. Otago, Southland and Fiordland, cloudy areas tonight, a few coastal showers, fine spells tomorrow. And Chatham Islands, occasional showers. RNZ National, it's coming up to 8 minutes past 6.
Thanks, Susanna. This is Checkpoint and I'm Lisa Owen. Health officials are still racing to track the origins of the community outbreak of COVID-19 as the cluster hits 17 cases. Since 4 members of the same Auckland family tested positive, a student at Mount Albert Grammar is confirmed to have the coronavirus, as well as 3 workers from a cool store, a finance company worker and one of their family members. And there is also 7 family members of already infected people who have the coronavirus too. The Director General of Health says all the new positive cases will be moved to managed quarantine facilities, and all staff working at the borders, including our ports and managed isolation facilities, are in the process of being tested. Prior to this latest outbreak, physics professor and disease modeller Sean Hendy was calling for all those frontline workers to be routinely tested once a week. Professor Hendy joins me now via Skype. Kia ora. So 17 cases so far in the community. From what you're seeing here, what is the pattern telling you?
So everything is still linked to the cold store facility, and that's good news in some ways. Because we haven't seen other clusters out there in the community. It's also a little bit unnerving in the sense that we still don't know the route of transmission from the border to the cold store facility, and that's absolutely crucial for us being able to estimate how bad this outbreak might get.
You say how it got from the border. Are you convinced that is where it came from?
Yeah, I mean, we were very sure that we'd eliminated the virus here in New Zealand. So, it almost certainly has come somewhere through the border. And I think there's been some indications, from the genomics that already that we are looking at something. It's not something that's closely related to the virus that we had earlier in the year.
Are you convinced that this family in South Auckland, which is being referred to as the index case, that they are the beginning of the infection?
So no, I don't think that, it really does come back to that cold store. So it's not this family in particular that it's pointing to. It goes back to that workplace. And so I think the strongest possibility is some connection from that workplace to the border some way.
So we know that they are taking swabs from products and they're awaiting tests from that. But is that really just to rule it out? In your view, is that an unlikely scenario?
Yeah, I think most things that I've seen suggest that is unlikely. There's a few pieces of evidence from overseas that do suggest that it can be picked up from surfaces. But what we know overwhelmingly is it's person-to-person contact that spreads the disease. So, that's still our most likely scenario. So, yeah, you'd want to rule that out, obviously, and, that would be important for maintaining future border security as well if that was an issue. But I think it's more to rule that out than the most likely cause.
Okay, so we are expecting a decision tomorrow as to whether the alert levels stay the same, they change, or they spread even further. Given that we do not know the origins of this case, would you be comfortable with us, being set free again in Auckland?
No, I think the decision to really let us free out of level 3 in Auckland, that would only be if we had really, really clear evidence of the chain of transmission, and if that was a relatively short chain of transmission. So we're not looking at other clusters that might have branched out, during the chain making its way from the border to the cold store facility. So I don't think that's probably not a likely outcome. We probably won't have completely clear evidence about that tomorrow. So I do think we're probably looking at extension of lockdown as the information comes in overnight and during the morning. That'll help build up a bigger picture, and Cabinet are definitely using that in their decision making.
We just had you drop out slightly there on Skype, Professor Hendy. So I just want to be clear for our listeners. In your view, you would extend the lockdown if we do not know the origins of the infection by deadline tomorrow. Then you believe we should extend the current conditions we're under.
Yeah, I think so. I think that would be the wisest thing to do. Give ourselves a little bit more time to investigate some of the linkages and just make sure we understand that the contact to the border. I do think there's going to be more information coming in tomorrow from our contact tracing and from the genomics. So Cabinet may well be in a good position to make a better call tomorrow. But in the absence of any information, I think you'd want to extend from where we are today.
How long for would you think would be realistic?
Well, I think, and again, it'll depend on what we learn in the next 24 hours. I mean, if we don't learn much new, then I think we would push it out to maybe give ourselves more time to gather that information. I know that would probably create a lot more uncertainty for people to push it out just a short amount. If we learn that we overnight and tomorrow that we have identified other clusters, then we might be looking at an extension of several weeks.
And at level 3, are you comfortable to remain at level 3 at this point, or do you think we need to lock it down harder?
My personal preference would be to go for a harder lockdown because that will be able to be in lockdown for a shorter period of time. But that's quite a difficult decision. They'll have to take quite a few things into account. Including the ability of the city to maintain its borders at level 4 for that period of time. So, I think it's a difficult decision between level 3 and level 4. We think both are able to contain the virus, but level 4 would eliminate it faster.
Okay, so the rest of the country's at level 2. Today, we kind of get a more fulsome picture of where some of these infective people have been. Rotorua, Taupō, Waikato. Again, from what you know and your modelling skills, do we need to do any more outside of Auckland in terms of containment?
I mean, I think at the moment, people, and this is really for the way individuals behave. Level 2 is at the moment is probably a reasonable restriction given what we know. But we should all be cautious. We should assume that the virus has travelled outside Auckland, and that means being really aware of symptoms. And if you do start exhibiting symptoms, stay home from work and make sure you get a test.
So we're up to 17 confirmed community cases at the moment. I'm sure you've been running some figures. How high are you anticipating it will go?
Yeah, so let me be clear. There's big error bars here, and it depends a lot on the information that we'll find out in the next 24 hours. But the simulations we've been running suggest that maybe 30 to 40 active cases at the moment, and with a sort of an upper limit of 70 to 80, something like that.
If they are all connected to that one cluster, is that the best case scenario that we could hope for?
Yes, no, that's right. I mean, I think if this is the only cluster that's active, then that's actually really good news. I mean, there'll be a long period of uncertainty unless we can nail down that direct connection to the border where we don't know, and that'll of course make a lot of us who are watching very nervous. But if this turns out to be the only cluster, then actually I think we've probably got quite lucky.
It's not a kind of told you so moment, but you obviously had been suggesting that all workers should be tested at least once a week, workers who are on the front line. Is this proof of how necessary that is?
Yeah, look, we still don't, yes, look, I'd still like to advocate for that. I still think that's an important thing that we should be doing, but we still don't know what the cause, what the route of transmission was. And it may well be through the managed isolation and quarantine facilities. That's what we were specifically commenting about. But there are other possibilities, for entry of the virus. And so I think, that'll be really important. Once we find out what has been the chain of transmission into the country, then, finding that loophole and shutting it down, I think would be absolutely essential.
Just one thing before you go. Do we know enough about this virus to rule out the fact that it could have been dormant somewhere or a reinfection of a person who's had it earlier and was already in the country?
Yeah, look, I think we can rule that out on the basis of the genomic evidence at this point. It's of course, this is a tricky virus. It is a new virus. But I think that's extremely unlikely at this point.
Really appreciate your time this evening. That's Professor Sean Hendy joining us via a sometimes scratchy Skype line. Aucklanders have once again mobbed testing clinics across the city, more of which have popped up to cope with the demand. Traffic snaked for hundreds of metres outside some centres, where people who were turned away yesterday returned for another long wait today. Police at the region's new border checkpoints stopped almost 20,000 cars and turned back more than 300, including people trying to get to their holiday homes. Jordan Bond reports.
A chilly start in Eden Terrace in central Auckland. One woman has been waiting outside the community testing centre for more than an hour before it opens at 8 o'clock. And she's not the first in the queue.
I came yesterday, waited for 3 hours, and then came later and waited for 6 hours and gave up. So came early this morning, had parked somewhere else so I don't get caught in the traffic.
She's had a runny nose, a cough and a fever since the beginning of the week.
Because I have symptoms, I'm a nurse, I just need to be checked out so I can go back to work.
Francis Collier arrived at the Eden Terrace Centre at 1 o'clock yesterday, but it was so busy he didn't get tested. He's back for another go. He's got flu-like symptoms and doesn't want there to be any doubt. Mr. Collier says he's less worried about himself.
Not my own health, but yeah, just concerned for it spreading. So this is the best way to get on top of it, is everyone tested and find out where it is.
Testing capacity was expanded today to take the number of centres to 15. 11 pop-ups and 4 community assessment centres. At one centre in St Luke's, lines of cars stretched for hundreds of metres. Megan Anderson says she arrived half an hour before the doors opened.
There was a lot of people in line already, maybe like a few dozen cars already, and that was a half hour before it opened, so it's been a long wait.
Ms Anderson is not worried about herself, but wants to make sure she doesn't give anything to her flatmates and the community if it is COVID.
I've had a fever for the last few days and a sore throat, which I had assumed was just a regular cold, but then hearing that this case came out, it could be COVID. I don't think it is, but who knows?
Retiree Jim Blackett from Whangaparaoa arrived in the queue at the Northcote Centre yesterday morning. 3 hours later, he was told it was unlikely he'd be seen that day.
That it was going to take me still another 4.5 hours to get through, by which time the clinic would be closed. So I took their advice and came home.
This morning, he was in line for a test at another centre in Warkworth. More than 3,500 people were swabbed at community testing centres in Auckland yesterday. Meanwhile, at the city's northern outskirts, police and Defence Force staff were manning one of 9 new checkpoints and interviewing those trying to travel in or out of Auckland. At the travel border north of Wellsford, 80 kilometres from the central city, this carload had a laminated work letter from their boss.
We're just heading down to finish off a job we got going down there.
Okay, what do you do?
So we plant native trees and we've started it off and we have to finish, otherwise they're going to die.
Do you mind if I see some identification to go with your letter?
Yeah, so that's me.
No worries. Thanks for your cooperation. Have a good day.
You too.
By 7 this morning, around 300 vehicles were turned back by the police at the city's checkpoints, including some people trying to travel to holiday homes. Signs on the Northern Motorway remind people that leaving the region is strictly for essential travel. One man who was turned away struggled to prove the job he was going to was permitted.
So they thought roofing wasn't classed as essential, but it is part of construction, so I've just got to wait for a letter from the boss. And I'm fine because I'm going fishing.
Got the day off then?
Yep, so I'm happy.
Nationally, more than 10,000 swabs were taken yesterday, and many more thousands missed the midnight cut-off for the Ministry of Health's daily update. Mo te hōtaka o te ahi nei, ko Jordan Bond. Aho.
And we've just had an update from the Northern Regional Health Coordination Centre. That's basically the conglomerate of DHBs handling the testing in the Auckland area. Now, these are the testing records for yesterday, so Wednesday. They say in Auckland there was more than 7,800 tests registered by the city's laboratories. And the tests on Wednesday included 3,546 people who were swabbed at community testing centres, with similar volumes taken collectively by general practices, urgent care clinics and mobile testing units. And one interesting thing to note, from tomorrow there is a new location for one of those community testing centres. So from 8 a.m, tomorrow morning, the Central City Testing Centre, which is currently in Eden Terrace, is going to relocate to Eden Park. The location in the stadium's bus hub is on the corner of Sandringham and Remus Avenue, and they say it will provide a better flow and a safer environment for pedestrians, because I know there's been a few traffic gnarl-ups. They say it's got good access for walk-ups if you want to get a test. So that's a change of location, moving to the Eden Park Stadium from 8 a.m. tomorrow. And we've got a big list of all the testing centres, and we'll put that up on our Facebook page for you there if you want to look where you might be able to go for a test. It is almost 23 minutes past 6 and you're with Checkpoint on RNZ National. Let's head to the UK now, where 3 people have died after a passenger train derailed and caught fire in Scotland. It's thought the train hit a landslide in Aberdeenshire after heavy rain and flooding in recent days. The train's driver, conductor and a passenger died in the incident. The BBC's Lorna Gordon reports.
The tangled wreckage of the derailed train. One passenger carriage halfway down a bank. Another carriage seemingly crushed in the force of the crash. What's left of the early morning service from Aberdeen to Glasgow. The scale of the incident all too clear. Scotland's First Minister expressing her shock at the day's events.
This is devastating news. This has been a really tragic incident, and my condolences are with the loved ones of the 3 people who have lost their lives, and that includes the driver of the train. Clearly, this is an ongoing operation. I've just been briefed by Network Rail and the emergency services on that, but devastating news for the bereaved, but also for those who were on the train, and my best wishes go to those who sustained injuries.
The weather overnight was described as atrocious. Early indications are that the derailment in this rural part of Aberdeenshire may have been caused by a landslide. The emergency services working to get the injured to hospital and recover those who died, the driver, the conductor and 1 passenger on the train. Over the coming days, investigators will try to piece together what caused this tragedy to occur.
We really need to take the time to understand exactly what caused this event. The railway is an exceptionally safe mode of travel, but we just need to take the time to understand why this has happened.
The Queen, who is also currently in Aberdeenshire at Balmoral, sent a message of condolence, stating that the entire royal family joined her in sending their thoughts and prayers to those who had died and those who had been injured. That sentiment echoed by the Prime Minister.
One of the reasons that this accident is so shocking is, of course, that it is this type of accident on the railways is thankfully so rare. But our thoughts are very much with those who've lost their lives, their families, and of course those who've been injured in the derailment.
For much of the day, smoke was seen billowing out of the valley where the wreckage now sits. A sombre marker of the scale and force of what happened here and the challenges that faced first responders on the ground.
And that was Lorna Gordon reporting. Dogs have been suggested as a possible way to detect COVID in the community. Next month, trials are set to begin in Australia to test whether our canine friends can be used to sniff out COVID-19. The ABC's Annie Guest reports.
With their 200 million or so scent receptors, dogs are detecting diabetic lows and imminent epileptic seizures, among other ills. These superior snouts are now being called into service as COVID sniffers. Veterinary researcher Dr. Susan Hazel is from the University of Adelaide.
The dogs could be a real game changer. Even picking up, 10 asymptomatic people in a week's time, that can lead to 100 or more cases. So to flatten the curve and try and suppress, the dogs are going to be vital.
She's part of an international research project led by Professor Dominique Grangin from France's National Veterinary School. In April, he began training dogs, mostly German Shepherds and Labradors, to sniff out COVID-19, then sit after finding it.
It was really a great surprise for us to see that in one day, the dogs were able to remember the odor of the positive COVID.
The odour comes from sweat scraped from people's armpits into containers that are then attached to stainless steel cones sniffed by the dogs. It's believed the smell is created by metabolic changes as the body responds to coronavirus. The French island of Corsica started officially using the COVID sniffing dogs last month.
In Corsica, been using them on different clusters.
Okay, and tell me about the results you've had so far in Corsica. How many cases have they sniffed out?
They found 4 cases of real positives that had been negative on PCR. And this was out of something like 600 samples.
Trials are also underway in Chile and Belgium and...
Welcome to Dubai International Airport.
The dogs are already being used in the United Arab Emirates, where the Interior Ministry has released promotional videos of airport staff.
The UAE is a pioneer in this field. We encourage all countries to use this.
Passengers also spruik the COVID-sniffing dogs.
It barely took a minute. It was very easy.
And that was Annie Guest with that report. Well, earlier in the program, we did ask you to send us pictures of you wearing your masks. Now, you've told us you've been making them out of all sorts of things, from socks to the sleeves of old dresses. So stand by, here are some of them. Anne emailed us. This is her 7-year-old daughter wearing a mask made by her 14-year-old sister. If you can't see it, it's made with a scrap of creamy fabric with what looks like tiny little strawberries on it. Well, it might even be cherries. Very cute, rocking it in the picture. Let's now go to the Max. The Max have emailed us. She's actually making masks while she's watching Checkpoint in the background. Thank you very much. And it's a black and white, well, they say it's a tartan number, but I reckon it's more gingham, isn't it? Looks good with the red glasses. And here's Roger and his wife doing a shared selfie. They're wearing cool masks. Roger has a black one with coloured musical notes, and his wife has a white and burgundy floral one. Great picture. And here's Pete. Pete's wearing a black and white pirate mask. Pete wears glasses and says his mask comes equipped with an anti-fog tissue. Wow, that's high-tech, isn't it? Now, we will get a montage of some of those face masks up on our Facebook page. So thank you for sending them all in. Bit of feedback. This one from a listener who says the Coromandel Peninsula is filling up with Aucklanders. Why do they think that the rules do not apply to them? Good question. Sorry, we're hanging our heads in shame on behalf. Another person says, please remind your listeners that testing can be done at GPs for free. It's vital people test.
RNZ News headlines at 6:30. Cabinet's decision on whether Auckland's Level 3 lockdown is ended or extended will be announced late tomorrow afternoon. A COVID-positive patient visited a rest home in Morrinsville, not Matamata, as the Health Minister initially told Checkpoint. All three government parties have labelled the opposition dangerous and irresponsible, accusing it of spreading misinformation. A new study shows young New Zealanders with deteriorating mental health don't feel they're being heard and are concerned about their future. That's the news.
Tonight on Nights, photographer Raymond Sana Polutele will be updating us on how people of South Auckland are dealing with the latest lockdown. On Our Changing World, Alison Balance meets a food scientist who says that all our senses come into play when we eat, and she's discovered some interesting things about the effect of sound on the way food tastes. And our overseas correspondent, Rana Collins,